Welcome back on this Friday morning. Listen to this. Over 50% of men age 60 and above struggle with enlarged prostate problems. Now, the good news is that there are non-surgical treatments that can make the management of an enlarged prostate a whole lot easier and much more comfortable than ever before. Here to tell us more is Dr. Goke Akinwande with Midwest Institute for Non-Surgical Therapy. How are you, sir?
I'm doing great. You always say my name right.
Well, I appreciate that. I've been practicing in the dressing room for a little while. It's nice to have you back. You're really putting me to the test here because there's a lot of big words.
Yes.
First things first, though, benign prostate hyperplasia.
Yes.
What are we talking about?
So it's enlargement of the prostate that compresses the tube that leads from the bladder to the penis and just causes urinary problems. Some people can't make it through a road trip without trying, finding a bathroom, or they wake up in the middle of the night to go pee, or they have issues with getting the pee out or the urination out. So that's a big problem in men, especially as you get older.
And as we just mentioned with the statistic at the top of the segment here, very, very common in men.
It's very, very common.
So how has this been treated traditionally, and what are you able to do that's new and bringing to the table?
So the most conservative way to treat this is medication. You give medication to either shrink the prostate or enlarge that tube I was talking about.
Right.
Surgical options are basically going through the penis and carving out areas of the prostate to allow more room for the urination to go from the bladder to the penis.
Got to level with you. It doesn't sound super pleasant.
No, so I mean that's the reason why they ask for procedures that are less invasive,
right,
like prostate artery embolizations, which is what I'm trying to talk to you about.
And you just mentioned that prostate artery embolization. What is that? How does that differ from the treatment you just mentioned?
So basically, we're going with a tiny little pinhole incision in the wrist. As you can see from the screen, we get down to the arteries that supply the prostate, and we basically embolize it. Embolization means slow down the blood flow to the prostate. What happens is that the prostate now shrinks, and when it shrinks, it allows that tube to get bigger, I guess, and allows the urination to leave the bladder and come out, the penis.
So explain to me why that would be better than the more traditional surgery. It sounds a lot less invasive, I'll say that.
Yeah, I wouldn't exactly say it's better. I would just say it's more convenient, it's less side effects. It's an outpatient surgery or a procedure that takes about 45 minutes to do. You'll be out the first day. You leave with a Band-Aid and no hospital stay. And yeah, you don't have to go through surgery. Most people don't want major surgery.
No, and so recovery time, it sounds like, is quick.
It's really quick. Literally, after you leave the procedure, you have no pain. You go home. We usually give you like maybe Tylenol or something. So no long recovery.
So is this sort of embolization to treat enlarged prostates, is that something that's covered by insurance?
It is. It's covered by insurance, mostly Medicare and Medicare products, like kind of like the Medicare Advantage products. Private insurances are coming around, but not quite. They're not quite ready.
Well, that makes sense because Medicare, most of the people, not everyone, but most of the people dealing with this are going to be in that.
Exactly. That's the majority of the population.
Well, if nothing else, make a call and just inquire and look for more information maybe online. Doctor, thank you for being here.
Thank you.
We appreciate it. First time in the new building. Always nice to have a guy that used to join us downtown out here in Maryland Heights. The Midwest Institute for Non-Surgical Therapy has locations in St. Louis and in Swansea, Illinois. You can give them a call, 314-255-2204, or as I mentioned, check them out on the web. The website is mint, M-I-N-T, mintstl.com.
Gentlemen, thank you. Okay, so you think your house is ready for a fall makeover, but you're not up to date on the latest products and trends. No fear.